Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
Memphis Mayor Jim Strickland tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian, continuing to do Behind the Headlines remotely, and I am glad to introduce Mayor Jim Strickland. Thank you for being here.
Thanks for having me.
Along with Bill Dries, reporter with the Daily Memphian. Mayor Strickland, you are, I believe, in your office down at City Hall. Is that correct?
I'm at City Hall. We probably have less than 50 people in all of City Hall. And other than me and a police officer, we're the only ones on our floor. We've really tried to push and lead by example on people working from home.
We will talk today, and again, thank you for doing this because I know you have even more going on than normal, but we'll talk today, big picture of kind of where things are as we record this Wednesday morning, but also talk about the big picture of what's next, of testing, of the things that, you know, the notion of reopening, which sounds like to some people very far away and other people pushing for that to be sooner, and try to get through everything we can. But as of Wednesday morning, 10 o'clock-ish, where are we, best estimate from the information you're getting, where are we relative to the peak that people keep talking about, the peak number of patients and illness and so on?
Sure. There's three models that I know of. One was from the University of Washington. What I'd ask people to is ignore that one because that showed the peak, I think, this week. Vanderbilt's done a model, and our local health department and doctors have done a model, and they're both very similar, basically showing the peak will occur sometime between late May and mid-June. I've talked to both groups independently, and they've been working together a little bit. So I have faith that they, as best as possible, are estimating that time. I know that's a long time away for people. You know, that's 6 to 8 weeks. But that looks like it's going to be the peak.
Where are you? I mean, just this week, President Trump began to talk about, you know, trying to reopen the country May 1st. He's kind of gone back and forth on that a little bit. But fundamentally, do you feel pressure or influence from the federal government as to when Memphis reopens within your authority?
No, I don't feel any pressure from the federal government or really any government level of government. I feel if there's pressure, it's from my fellow Memphians, thousands of whom have lost their jobs, hundreds of whom have had to shut their businesses or they're on the verge of closing. And then the health and well-being of the entire populace of Memphis and Shelby County. That's where the pressure comes in. And when I say pressure, it pales in comparison to the actual pressure that people are out there feeling whose businesses have been affected and who've lost their jobs. That's real pressure. What we're going through at government trying to make these decisions is very slight in comparison to what they're going through.
Yeah, we'll talk a bunch more about the notion of reopening and how that happens, but let me go to Bill Dries and bring him in here.
Mayor, do you know from looking at other counties and models for other places in the state whether our peak or our high point in the virus is the same as it is for other parts of the state?
I don't know that for sure. Vanderbilt is going to try to narrow in that a little bit more, but it does appear that that Memphis and Shelby County is doing about the same as Nashville and Davidson County. So I could see where those would be similar, but Vanderbilt actually this week may come out with some more detail on that. But you tie the Vanderbilt study into the local one. I do believe that Memphis will hit its peak between late May and mid-June.
And the reason I raised that is because I think you were on a conference call with Governor Lee yesterday that also involved some leaders in Knox County and Knoxville. Is it possible that the reopening, quote unquote, of the state and of the nation for that matter, that it kind of is different in different places? Is that something that you're talking about at this point?
Yeah, I don't think there's any doubt. Lake County and Shelby County, although we're only a couple hours away from each other, are probably worlds away with respect to this virus. So I think the governor is taking that into account. And when he, quote, reopens business, I think you may see it phased in differently throughout the state. One good thing about that call yesterday, whether it was a very good call yesterday, but the best thing was the governor was very open to hearing local opinion with respect to when our locality should open, and we will be involved in those conversations over the next couple of weeks.
Mm-hmm. What you're hearing from the businesses, we've had, I think, 3 stimulus packages, for lack of a better term, that Congress has passed. The president has signed, totaling trillions of dollars. Is that aid getting to the places it needs to get to ease some of the pressure that you're hearing from business owners?
I think some of it is. I think businesses are having trouble with the SBA website. Bankers are really working overtime. I've talked to bankers, they're working 20 hours a day trying to help small businesses get those loans. So I think with the huge crunch of going on these websites has really delayed somewhat. But for the most part, I think it's working. And although I do think, and this is just my opinion, the checks to the individuals, the stimulus payments to individuals, there's probably gonna have to be another one. I know people today and tomorrow will be getting their first checks. That's not gonna last that long.
Right, and Congressman Cohen has talked about it just the day before this, about the need for a second round of payments in that regard. Before I go back to Eric, another question: is there any circumstance in which the terms of essential, non-essential businesses, the state of civil emergency, are there any circumstances where that would change in Memphis prior to the city hitting the peak?
Yes. I mean, we reevaluate it a lot. But what we're trying to do is be in coordination with our sister cities in Shelby County so that we all kind of make the same decisions at the same time. We've been thinking about tweaking our order a little bit, but I want to float that by these Mayor Harris and the mayors of the sister cities. So as you will recall, we got out front on the early orders, and what we've agreed to do is all work collaboratively because it makes sense that we kind of make the same decisions. But yeah, I don't see any major changes, but there could be some smaller ones.
Tweaking it which way? More?
Well, both ways. I think
Okay.
there are some things that could be more constraining. Some things industry's already doing themselves. The grocery stores are already limiting capacity to about 50% in the stores. That probably wouldn't be a bad idea to put it in the order so that we know the reputable grocery stores are doing it, but we want them all to do that. So that would be a little bit of a constraint. We've talked about car washes, for instance. There's a lot of car washes where it's automated. The whole thing is automated and you don't even get out of your car. Should that be allowed? Right now, under the city of Memphis's order, no car washes are allowed because it didn't fit into essential services. But now looking back at it, there's so many different kinds of car washes that there's some that are completely automated. Maybe they ought to be allowed because there's social distancing going on. That's probably the longest car washes has ever been discussed on this show.
But you've had a lot of complaints that have been called in from people saying, hey, why is this car wash open when it's not supposed to be?
Yes, and that's kind of brought it to our attention. And there's a lot of car washes in Memphis, and there's all different kinds. So through that process, we've been educated as far as the different kinds. I'm not saying we will do it, but that's certainly on the radar.
In terms of this whole notion of reopening and the models that predict peaks, all of that is, as I understand it, is very dependent on testing and what is the state of the spread or containment of the virus. Where is Memphis, Shelby County right now in terms of availability of testing? Do we have enough tests happening right now?
No, but this is the interesting thing about it. Tiger Lane and Christ Community have really gone out into the community and outside the hospitals to test. Both are under capacity, meaning we don't have enough citizens using those services right now. We don't have enough people using Tiger Lane or Christ Community. So there's hundreds of available tests, maybe not hundreds, but dozens of tests going without usage. Now, on top of that, though, we do need more tests. I know that seems contradictory, but we need more tests, not only in Memphis, but throughout the country, because the way, no matter when we reopen business, whether, no matter under anyone's scenario, what we have to do is contain the virus. And to contain the virus, we need heavy testing. Not only people who are symptomatic, but those who are asymptomatic. And that's what we haven't been doing a lot in Memphis, and I think the United States. Right now, mostly it's only been people who show symptoms that are being tested. We've got to test a broader audience. And a former CDC director, talked to a group of mayors that Bloomberg's put together, 500 mayors who take part in this call. And he said, testing is the backbone to boxing in the virus. You have testing up front. All those who test positive need to be isolated at their home. Then we contact all their contacts, and then we isolate those contacts. So that forms a box to hem in the virus. That's what South Korea did, and they didn't have to close down businesses. Now, the natural question that you're going to have is, how many tests do you need to be able to do that? I don't know that yet. I can't quantify it, but that's where we need to be. So we need way more tests than what we have now.
And those tests, well, there's two parts. Who will quantify that for Memphis, and who will pay for that test?
Those are really good questions. The first one I know is going to be Dr. Haushalter, Dr. Jane, who are head of our medical task force, in consultation with the hospitals and the experts. The experts are going to be able to tell us that. What's a harder question to answer than who to pay for it is how do we get them? Cities are about to get a stimulus check from the federal government. So I think we're going to have money to be able to do it. Is can we get access to them? Are there enough being manufactured? Are there enough swabs being manufactured? I think to date, the answer is no. So we need America or the world to really step up so that Memphis and other cities can fully test.
And this isn't a thing, I'm asking a naive question, but I'll ask it anyway because someone was floating with me. I mean, we've got a very robust medical community here, the hospital, St. Jude. I mean, there's just a tremendous medical community. Is it not something that can be done locally?
Manufacturing the tests, the hospitals don't actually manufacture the tests. They're a factory. There's I don't even know the names of the companies that are manufacturing those tests. I do think to some degree, like UT has looked into this, but to do it on the volume that this country needs, I don't think we're going to be able to rely on our local hospital systems to do that. We need large manufacturers to do that. Now the hospitals and the providers will help us because you're going to need manpower to actually administer the test. That's another challenge that we're going to have, but I think we can meet that challenge. It's the first challenge of getting the test.
the other part of reopening and the model that you just described, and you look at the countries like South Korea and Germany, I think Iceland is one that have done much, much better with this. It was one, mass testing at the federal level on down. And then it was contact tracing, which you described. So when you do have somebody who tests positive, you have government or volunteers or some sort of staff that can say, well, who did you talk to, where? So you can, again, begin to isolate, or as you said, box them in. Is that something the city of Memphis is going to do? I mean, the city of Memphis is going to hire people to do the contact tracing. Will that go to the health department, the hospitals, or all of the above?
Well, by law, the health department's administered with that duty. So they're in charge. But what we've done at the city of Memphis is, because so many people are working from home, we said immediately, like a month ago, whenever we did send people home, that we can reassign you to do more urgent needs. Well, we have about 40 city employees who've been trained and now are working under the health department doing contact tracing. And we're fully prepared to send more, because you think about it, our libraries are closed, our community centers are closed. We have really qualified, smart people who can do these things. So if we need to train up more, which I suspect we'll do, and I think UT is also helping, the health department, maybe some other organizations. We may need hundreds more contact tracers if we really ramp up testing.
And can the city afford that, or is that dependent on that stimulus money, or
a little both? I think as long as libraries are closed, we can reassign employees. But that stimulus money that we're going to get, which I don't know how much we're getting, and I'm not 100% sure when we're getting it, but that money can be used for that.
We'll come back to that, because I imagine, I would go to Bill, but the city's going to have other needs as they hit to tax revenue, so on. And we'll come back to those issues, but let me go back to Bill Dries.
And let me talk about something you've got coming up this coming Tuesday. You are scheduled to present your budget proposal to the Memphis City Council, and that's still on, right?
Yes. I guess I've been involved in, I don't know how many budgets now between council, and this will be my 13th, I guess. This is the oddest one ever. Even before coronavirus, I said this was the toughest budget we've had. Coronavirus has just thrown, and Memphis is not alone, but thrown cities into real challenge. Just like businesses are challenged, we get our money, a lot of our money, based on sales taxes and property taxes. Well, sales taxes are decreasing. There's no doubt about it. Property taxes, there are probably fewer people who can afford to pay their property taxes now. So we're going to take a hit, not only in the upcoming budget, but in the current year budget right now. The April sales taxes, we don't get probably till June. So we probably may not feel an impact until May and June, when we start getting money from the state on those sale taxes, but they're going to be less. So we're going to have some kind of deficit in the current budget, and then projecting forward. And this is what I'm going to talk about Tuesday. Where do we project, and how much do we project to lose in the different revenue streams that we have, and what challenges that provides us? I do think there's help coming from the federal government, but it's not going to be here before next Tuesday. So, but I think it will be here before the council has to vote on a budget.
Right, and some of the sales tax revenue is pledged some pretty major projects that are within tourism development zones. But as I understand it, there are some more safeguards there in terms of the revenue that goes back into those projects within the TDZs. Am I correct on that?
Yeah, because the TDZ is kind of a subpart from our budget. What I was talking about a moment ago was just our overall operating budget, normal budget. Mm-hmm. TDZ is where we get the state sales taxes and can do help projects like the Lowe's Hotel and that sort of thing. There are some safeguards in that. I don't think that will take a hit nearly as much as our operating budget, but we will have to monitor it for sure, and we will.
Are any of the private parts of those big projects, are they telling you that there's any change in their plans because of this pandemic?
No one's really told us that plans have changed, but I do think there's a natural assumption that things may quiet down for a little while. I mean, I know it seems longer, but we've really only been in this environment for about 30 days. It seems like a year. Um, so I'm sure just like the newspaper business and city government and any business, they're kind of trying to get their hands around their financing. But no one has told us that no, they've abandoned their plans or they're pausing it. Um, but you know, so that's good news.
All right, I'll throw it back to Eric.
Yeah, let's talk a little more about some of this economic pressure and this notion of reopening, because you hear it. I mean, people, again, people who need jobs, all the economic impact. What are those criteria for you and again, presumably a phased reopening, not a flip the switch and we go back to normal. I mean, that's not going to happen. But like we dwelled, as you said, for a long time, we studied car washes, but other businesses that could phase in reopening and other businesses that could phase in with new restrictions and operating in different ways. I mean, is that what you're planning for now? And what is the criteria to hit those reopenings?
Yeah, I do think it's like a water faucet where it was slowly turned off, it was slowly turned back on. What those businesses are in what order, I don't know. The medical experts will have a huge opinion on that. The criteria that I want to use in evaluating it, before I get to the criteria, the goal is to keep the virus from overwhelming our hospitals. We've said all along that there's no way we can totally prevent the disease from impacting anyone in Memphis. What we can do is just try to lower it so that it doesn't overwhelm our hospitals. To do that, when we reopen, I would like, at least for a major reopening, the positive cases start going down. We've hit that peak and we're on the other side of the peak. And then we establish that box that I talked about earlier, widespread testing and a lot of capacity to do contact tracing, isolation, and quarantining, so that when people do test positive, we can get them out of society and in their homes or in the hospital if they need that, so it doesn't spread. And if we can do that, if we can keep up with the virus that way and box it in, then we'll be successful at keeping businesses open. What you don't want to do is open businesses and then 3 or 4 weeks later have another spike, and then you have to shut them back down. But there have been doctors who say that's possible.
Will there be difficult conversations about not just restrictions on certain types of businesses? One can imagine it might be longer before a full-blown concert happens or a sporting event happens where people are sitting right next to packed into a big stadium, but also restrictions on people. I mean, the virus can hit anyone, but it hits older people harder. It hits people with underlying conditions harder. Could there be, within your authority as mayor, restrictions on certain types of people who fall into those high-risk categories?
I've heard that discussed. I think that's a possibility. I'm not saying there's a probability, but I've heard that discussed. As you reopen, you still want older people to stay home unless it's an essential task that they're doing. So that is in the mix, and I think that should be discussed.
One more before I go back to Bill. You mentioned talking to the governor. You see some governors, some states sort of getting, to put it lightly, frustrated with the federal government's response and kind of taking things in their own hands in terms of everything from ventilators to testing to supplies, PPE, all that. Have you heard from Governor Lee that they have a fairly large surplus right now? Obviously, that's going to take a hit, but the state has a level of money that the city doesn't. Are they being proactive in pursuing the materials that Memphis and the other cities will need, particularly testing, since we're focused on that?
Yes, to the degree possible. The state has ordered ventilators, which we all need in the state. The state has taken a lead in getting PPE. And they're going to conduct some testing surges particularly in rural areas that have not had access to testing, maybe starting soon. So all those things they've taken a lead on, and to date, we've had a really good relationship with Governor Lee on this, his unified command. And then as he gets this business reopening group, we're going to be involved in that too.
All right, let me go to Bill for a minute.
It sounds as if the discussions with the governor have been pretty congenial, but if push came to shove, if the president issued a proclamation about a reopening nationally, or the governor did for the state, and you disagreed with it, who would have the legal authority to order a reopening if it came to that?
I don't know. We are researching that, but I don't think we're going to get there, but we are researching it. But I really don't think we're going to get there with the state. The call yesterday, I think all of us on the local level, on the state level, all want to be on the same page. And we're going to work really hard to do that.
All right, with about 2 minutes left, there's been a lot of speculation about in general, our society being very different after this pandemic is over. What do you think about that? Are some of the moves we're making now kind of a preview of what life might be like on the other side of this?
I really don't think we're going to get 100% normal till there is a vaccine. And I know that's going to happen sometime in calendar year 2021. I don't know when that is. Until then, there may be some reopenings, but I do think people still wear masks. I do wonder about the large gatherings, whether that will occur. So, but I think once there's a vaccine, I've seen some debate on, the handshake is forever dead. I don't believe it. I just don't believe it. I think
you're a politician. You can't be dead forever. That's your currency.
So I just think human nature is to embrace each other, and I've found that true wherever I go around Memphis and Shelby County. So I think once there's a vaccine, and this can be treated like the flu or some other kind of disease like that, I think we'll go much more back to normal.
Quick questions as we end here. Are you coordinating with DeSoto County, Mississippi? I mean, that's our neighbor, just as even the state line is imaginary to the coronavirus.
We've invited them to the task force. I'm not sure they've participated yet, but I know the health department certainly is in contact with DeSoto County. Baptist Hospital has a huge facility down there. They're part of our task force. And Mayor Harris, as I believe, has talked to them. So they are part of our efforts. And the mayor of West Memphis on the Arkansas side takes part in our task force every day, or someone on his staff.
Okay, we will end this for now, but we're going to ask you a couple more questions that will go into the podcast, where that people can get on the website, Daily Memphian website, or extra video on WKNO. But for now, we'll end the regular show here. Thank you for joining us, and again, everyone, tune in for a few more questions as we take up some more of the mayor's time. Thank you, and join us again next week. So again, some extra questions here. Thank you, Mr. Mayor, for hanging on with us. On that question that we ended on, coordination with Mississippi, and there, is that frustrating for you? I mean, again, coronavirus doesn't see a border, and as you talked about earlier in the show, there's very close coordination with the county mayor, with the municipalities. Don't we need that with Mississippi?
I'm not frustrated at all with the coordination of local officials in Mississippi and Arkansas. If there's any frustration, is on a statewide level, why those governors won't do stay-at-home orders. If you look at per capita, Crittenden County has more positive cases than Shelby County per capita. We have a higher number, raw number, because we're so much larger. But I really wish the governor would step up like our governor has and be proactive.
Crittenden County being West Memphis and that area. One more thing about testing that I skipped over, and I wish I hadn't, but we've got it now. There's early indications that the virus is hitting disproportionately in African American communities. That is, I think, starting to happen in Chicago. It's happened in some other big cities. How does that concern you? Is that accurate? And what can the city do about that if it is true?
Well, there has been a disproportionate impact here in Memphis and Shelby County because I think our county population is about 55% Black, and about 70% of the positive cases have been in the African American community. So there is a higher percent there. There's a lot of academic debate on what caused that. In the short term, I can't involve myself in that. What we got to do is try to address the need ASAP. And that's why I think we'll announce Friday, the task force will, that we're going to expand testing into areas like Fraser and Hickory Hill, more mobile testing. We're going to go work with MHA and try to take testing to some of their apartment units.
That's Memphis Housing Authority. And just to note, we had Paul Young on the show last week, and he articulated the real difficult and dire situation that people in public housing might face and homelessness. And it was a very sobering conversation. I'll go back to you, Mr.
Yeah, because I said earlier that, not enough people are taking advantage of Tiger Lane. Well, part of the reason may be because they can't get to Tiger Lane. So we're going to take the testing there. And we're also, Paul probably talked about how we're going to be proactive in trying to test the homeless population. So those kind of announcements are going to happen Friday.
And will those be, and then I'll go to Bill, are those testing of people who don't have symptoms? Just anyone who wants to get tested, or do they have to have symptoms?
I think it's still limited to people with symptoms.
Okay.
But I'm not 100% sure on that. The only people that we've tested who are asymptomatic were really healthcare providers and first responders because of limited number of tests.
Okay. Bill Drees.
But in testing in testing people who are homeless, you're dealing with people who don't have a regular physician. So if they come up and say, "I think I might have it," it sounds like you're not going to quarrel with them.
Oh no, we're going to test them, and if they test positive, we've arranged for a hotel room so that they can be isolated. If someone homeless is on somebody else's contact list and needs to be quarantined, we've got hotel rooms for that.
Right. And you've talked about a goal of getting this up to 1,000 a day. And I think you're right at 750 right now. This is not as easy as it looks, is it?
No, it's, several challenges. One is getting people to the testing facilities. Like I said, we have a couple of places right now that can be used. The other challenge is getting testing out into the community. And then the number of tests is a challenge. And then the manpower to give the test. None of the three of us really are qualified to be able to give that test. You need somebody trained. Our fire department, the EMS workers, part of this Friday announcement is they're going to be the ones providing some of this testing at MHA facilities to expand the number of people giving the test so we can do more tests.
Let me do one last question, because that reminds me, senior facilities, obviously there have been some just disastrous and really tragic situations around the country and nearby in senior living facilities. One would imagine, in terms of the quote reopening of Memphis and the country, that senior living facilities are going to live under different rules for quite some time. Are you as mayor able to dictate those rules, or are they governed and regulated by different entities than the city of Memphis?
I think our lawyers tell me I can mandate things there, but what's been good with nursing home and senior facilities is they voluntarily have cooperated with the health department and officials here, limiting guests, and taking all the precautions they need to all throughout Shelby County. And that's really been, even beyond nursing homes and senior facilities, we've probably called on, between police and code enforcement, hundreds of businesses. And all but just a very small number are voluntarily complying. So that's been a very pleasant experience in trying to enforce that order that I'm not sure any of us anticipated.
All right, well, we could keep asking questions, but we will end it here. Thank you for hanging out for a little bit longer. We appreciate it. That is all the time we have this week. Even for the extended version, you can get the full version plus the bonus on the WKNO website. You can download the podcast from our site, iTunes, Spotify, wherever you get your podcasts. Thank you, Mr. Mayor. Thank you, Bill. Good night.